Imagine you're, at the absolute top of your game. Everyone thinks you're fearless, a real hero.
Hmm.
But then something shifts. Maybe a threat you just didn't see coming. Or like in that great Puss in Boots movie, you realize you're down to your very last life.
Ah, yeah.
And suddenly this wave crashes over you. Something you never expected, your heart's pounding, the world feels kind of distant, and you hear yourself say, I am afraid.
That scene, it really resonated, didn't it? Because it nails that feeling, that raw experience of intense fear, a sudden loss of control, even in someone who seems invincible.
Right.
It's a really powerful way to sort of kick off our deep dive today. We're looking at panic attacks and panic disorder.
Exactly, because what Puss goes through, it really echoes what a panic attack is like. We're not talking about just feeling, a bit stressed or nervous.
Not at all.
These are distinct, really intense periods of just overwhelming fear that can hit you, often totally out of the blue.
And to really get into this, we've gathered quite a few sources. We have personal takes, like how Brightside Health describes trying to explain the feeling.
Okay.
Then there's the foundational medical info, say from the Mayo Clinic, giving the nuts and bolts of symptoms, diagnoses.
Right, the basics.
And we're also digging into the clinical side, the detailed evidence-based guidelines from experts, like the practice guideline for treating panic disorder from Psychiatry Online.
So our mission here is to pull all this together. We want to understand what a panic attack actually feels like, why it's so darn hard to describe, what panic disorder involves, and crucially, what the experts say works for understanding and treating it based on these sources.
Sounds good. Let's jump in.
Okay, so let's start right there. What exactly is a panic attack based on these sources?
Well, the clinical definition you'll see is a discrete period of intense fear or discomfort.
Sounds a bit sterile.
It does, yeah. It doesn't quite capture the intensity. The key thing is how it hits you both physically and psychologically all at once.
And that's where the physical symptoms list comes in.
Wow. It's quite something. Palpitations, heart pounding like crazy, speeding up, sweating, trembling.
Absolutely. And there's more. Feeling short of breath, like you just can't get enough air in, or even feeling like you're choking. Chest pain or discomfort, which is terrifying because it feels like a heart attack. Nausea, dizziness, feeling unsteady, maybe like you're going to faint.
Yeah.
And even weird sensations like numbness or tingling, chills, or sudden hot flushes.
Just reading the list is intense. And then you add the psychological stuff our sources mentioned.
Yeah.
The fear of losing control or going crazy or that awful fear of dying.
Right. And sometimes derealization or depersonalization where things feel unreal or you feel detached from yourself.
That Brightside Health source really gets into the feeling of it, doesn't it?
It does. It talks about feeling physically like you're suffocating, that awful tightness in your chest, and how exhausting it is.
Exhausting. How so? Well, your muscles tense up so much you end up stiff, achy, and just deeply tired in a way that, sleep doesn't seem to fix.
I hadn't thought about that lingering exhaustion. And they also mentioned the shame.
Yes, immense shame. It can be so powerful. It stops people from doing normal things, seeing friends, going out. Really takes a toll on self-esteem.
Which loops right back to Puss in Boots, feeling like, I am nothing, right?
Yeah.
That total contradiction to his fearless hero image.
Exactly. That clash, that shame can be just as crippling as the physical feelings.
And you mentioned the chest pain feeling like a heart attack. Our sources stress how often people mistake it for that.
They do. Because the physical symptoms, heart pounding, sweating, stomach issues, are so intense and so real. It's genuinely scary not knowing what's happening to your body.
Yeah, you'd rush to the ER.
Many people do. And the other unsettling thing is how unpredictable it can be. The sources say attacks can just creep up, find 1 minute, struggling to breathe the next, not always an obvious trigger.
Wow. So it's this incredibly intense mix, physical, mental, unpredictable. And our sources are clear. Symptoms vary, right? Some people get a few, some get the whole list.
Exactly. But however it shows up, the intensity is real and the experience is valid.
Which leads straight into the next challenge. Explaining it. Brightside Health really focused on this, didn't they? Why it's so hard.
It really did. I mean, how do you put words to that kind of internal chaos? Especially if you're talking to someone who hasn't felt that level of anxiety or doesn't know much about it.
Yeah, it feels like trying to describe, I don't know, the color blue to someone who's never seen it. You worry you sound like you're exaggerating or they just won't get it.
That's a good analogy. But the sources also really push the benefit of trying. When you manage to explain it, even if it's not perfect, it makes the struggle feel less isolating.
Okay.
And it helps your loved ones understand what's going on, maybe how they can help, or just be there.
So it's tough, but really important to try. And they mentioned getting help finding the words.
Yeah, that sometimes a mental health professional can help you figure out how to talk about it with people in your life, which takes courage.
It's vulnerability, isn't it? Like Puss, again, he initially says Kitty cannot hear of this. He's afraid she won't trust him because of his past actions. That shame makes honesty feel impossible.
Right, that fear of being judged, seen as weak. But then his friend suggests, maybe talking would help both of them.
Ah, that potential for connection. It's the flip side of the shame coin.
Exactly. Now, these attacks, they aren't always just one-off things. Our sources like Mayo Clinic and Psychiatry Online explain how they can develop into panic disorder.
So panic disorder isn't just having an attack, it's more complex.
Right. It involves having recurrent panic attacks, but importantly, they're often unexpected. And the key feature is the pattern and the intense worry that comes after.
Worry about what, specifically?
Persistent worry about having more attacks, or worrying about what the attacks mean, like, am I losing my mind? Was that really a heart problem? Or changing your behavior significantly because of the attacks.
Ah, okay. So it's the attack plus the fear of the next one. Mayo Clinic highlighted that, didn't they? That intense fear you'll have another one being one of the worst parts.
Precisely. It's often called the fear of fear. And that fear is what can lead to significant changes in behavior, which brings us to agoraphobia.
Which isn't just about open spaces like people think.
No, that's a common misunderstanding. Our sources define it much more broadly. It's a fear of places or situations where escape might be difficult, or maybe embarrassing, or where you feel help wouldn't be available if you had a panic attack.
So like being in crowds, on public transport, maybe on a bridge, or even just being outside the house alone.
Exactly those kinds of situations. It's really about feeling trapped or vulnerable if panic hits.
Okay.
And that fear, naturally, leads people to start avoiding those places. The Mayo Clinic notes that sometimes it gets so severe, someone might need a companion just to leave home.
Wow, that really shows how much it can shrink your world.
It can. And Psychiatry Online points out that panic disorder with agoraphobia generally tends to be more severe, more chronic than panic disorder without it.
Okay, so given how physical and scary these symptoms are, and how they can feel like other emergencies, what's the absolute first step the sources recommend?
Get checked out by a doctor as soon as possible. This is really critical
Why is that so emphasized?
because you absolutely have to rule out other potential medical causes first. The Mayo Clinic stresses seeing your primary care provider. Could it be a heart issue? A thyroid problem? Something respiratory you need to know.
Makes sense.
And Psychiatry Online adds that it's not just medical conditions. Certain substances can trigger or worsen symptoms too.
Like what?
Well, things like caffeine, alcohol, even some prescription meds like stimulants or asthma inhalers, or over-the-counter stuff like decongestants.
Right, so a thorough medical check is step one, non-negotiable.
Absolutely. Once that's clear, then a mental health professional steps in for a full psychiatric assessment. They look beyond just the panic symptoms.
What else are they looking for?
They're assessing your overall safety, critically. Suicide risk, which is higher with panic disorder. They look at how much it's impacting your life, your work, your relationships, and they screen for other conditions.
Because panic attacks can show up in other disorders, or alongside them.
Exactly. Things like social anxiety, specific phobias, OCD, PTSD, depression, substance use disorders. They often travel together. It's complex.
So the assessment helps untangle all that.
Right, to get a clear picture, so treatment can be really tailored to you. And Psychiatry Online also mentions subthreshold symptoms.
What does that mean?
It means even if you don't meet every single tick box for a full panic disorder diagnosis, if you're having frequent, distressing panic-like symptoms that mess with your life, that still often needs and warrants treatment.
Okay, so diagnosis is careful, rules things out, gets the whole picture. Then what about treatment? What works?
Well, our sources, especially Psychiatry Online, focus on the evidence-based options. Think of it like having two main tools, often used together. One is medication pharmacotherapy, and the other is therapy psychosocial interventions.
So what kinds of medications are we talking about?
Often certain antidepressants are the first line, like SSRIs and SNRIs. They work on brain chemistry over time. Sometimes older ones like TCAs are used. Then there are benzodiazepines.
Those are the faster acting ones?
Yes, they can provide quick relief for acute symptoms, but they need careful handling. There are risks, like dependence, especially if someone also struggles with substance use or depression.
Got it. And on the therapy side?
Cognitive behavioral therapy, CBT, comes up again and again as having really strong evidence behind it.
How does CBT work for panic?
It basically targets the unhelpful thoughts and behaviors that keep that panic cycle going. A big part is identifying and challenging what they call catastrophic misinterpretations.
Like thinking a racing heart means you're definitely having a heart attack.
Exactly. Instead of just a racing heart, which can happen for many reasons, CBT helps you test those thoughts and learn different responses.
It sounds like retraining your brain's alarm system, and exposure therapy is part of that.
Yes, a key part. It might sound a bit intimidating, but it's done very carefully and systematically. It means gradually and safely facing the things you fear.
Both internal things, like body sensations, and external situations.
Right. For internal sensations, the therapist might guide you through exercises that safely bring on those feelings, maybe running in place to get your heart rate up, spinning to feel dizzy, breathing through a straw.
Why do that?
So you can experience those sensations in a controlled setting and learn, through experience, that they aren't actually dangerous. You learn to tolerate them without the automatic fear kicking in.
Okay, that makes sense. And for external situations?
It's about gradually facing the situations you've been avoiding. Maybe going to the store, using an elevator, driving, starting small, and working your way up what they call a fear hierarchy.
Step by step.
Exactly. You learn you can handle it, even with some anxiety. CBT also looks at reducing safety behaviors.
What are those? Things like always needing water or checking exits.
Precisely. Or always needing your phone, or only going places with someone else. These things feel helpful in the moment.
But they actually keep the fear alive.
Yes, because they prevent you from learning. You can cope without them. They subtly reinforce the idea that the situation itself is dangerous.
Interesting. Did the guidelines mention other therapy points?
They mention breathing retraining can sometimes be included in CBT. Also, that group CBT can work just as well as individual for many people. And involving partners or family, especially to support exposure practice, can be really helpful.
What about other things like exercise?
There's some early evidence that aerobic exercise might help some people,
Yeah.
but it's a bit tricky. Exercise itself can sometimes trigger panic symptoms for some individuals.
Oh, right.
So if it's considered, it needs to be approached very gradually and carefully.
And what about combining medication and therapy?
Psychiatry Online suggests that combining them might lead to better long-term outcomes, especially for preventing relapse after stopping meds. But they also say more research is needed to be sure about the benefits versus potential downsides, especially if started together, or if using CBT with benzodiazepines.
And treatment isn't always easy, is it? Sticking with it can be tough.
Definitely. Starting meds can sometimes cause temporary side effects, maybe even a bit more anxiety initially. And exposure therapy is, by design, uncomfortable at first.
But people might drop out.
It can happen. That's why setting realistic expectations is so important. Understanding it takes time, and that initial discomfort is often part of the process towards getting better.
Okay, so moving on to managing this long term. What if treatment doesn't seem to be working well enough?
The guidelines suggest taking a closer look. Are there other medical issues or maybe other psychiatric conditions like depression or substance use that aren't being fully addressed? Is the person actually sticking to the plan, taking meds as prescribed, doing the therapy homework? Is the relationship with the therapist strong? Are there major life stressors getting in the way?
What about medication dose?
That's a big one. They specifically mention that underdosing antidepressants is common. Maybe the dose just isn't high enough yet to be fully effective.
And the goal isn't just feeling slightly better.
No, the goal is remission, really getting those symptoms under control so they're not significantly interfering with life.
You mentioned starting meds low.
Yes, particularly SSRIs and SNRIs. People with panic can be sensitive, so starting low and increasing slowly, gradually, is usually recommended to find the right therapeutic dose.
And once someone responds well to medication, how long should they stay on it?
The guidelines suggest continuing it for a year, maybe even longer, after symptoms improve. This really helps reduce the risk of the panic coming back.
And getting off medication, especially benzodiazepines, needs care.
Absolutely critical. It needs to be done very slowly, tapered gradually over months, not weeks. Stopping too fast can cause withdrawal symptoms and make the panic symptoms return with a vengeance.
Can therapy help with that process?
Yes, CBT can actually be really helpful in managing withdrawal symptoms during a slow taper-off medication.
And you mentioned co-occurring conditions are common.
Extremely common. Mood disorders, other anxiety issues, personality disorders, substance use. They often overlap with panic disorder and definitely influence treatment choices and outcomes.
And this links back to the risk assessment you mentioned earlier.
Yes, critically. Psychiatry Online stresses that the risk of suicidal thoughts and behavior is elevated with panic disorder, particularly when these other conditions are present. It's essential to assess for this risk in all patients.
It really underscores the need for comprehensive care.
Definitely. The guidelines also briefly touch on specific groups, like kids and teens with panic often have other disorders too. Older adults might have it less often, but when they do, it's frequently complicated by other medical or psychiatric issues.
Are there cultural differences to consider?
Yes, definitely. How symptoms are expressed can vary. Sources mention specific symptom clusters, sometimes seen in African American groups, or cultural syndromes like ataque nervios in some Latino communities. Beliefs about illness, and even genetics, can affect how people respond to treatment too.
So, overall prognosis, what do the sources say?
They acknowledge that panic disorder, particularly if agoraphobia is involved, can often be chronic. Many people improve significantly with treatment, which is the good news,
Mm.
but residual symptoms are common and relapse can happen. The positive side is that treating the panic disorder often helps improve those co-occurring conditions too.
Okay, that was definitely a deep dive. We covered a lot of ground there. If we had to boil it down, what are the main takeaways?
I think, first, really understanding that panic attacks are incredibly real. They're not just anxiety. They are profoundly physical and psychological events.
Right, and why they feel so much like a medical crisis. And that even though explaining it is hard, trying to communicate that experience is so important for getting support.
Exactly. Also, knowing that recurrent attacks can become panic disorder, where that fear of fear cycle and the avoidance can really take over someone's life.
And crucially, the absolute need for a medical checkup first to rule out other causes before getting a proper mental health assessment.
Yes. And finally, the hopeful message.
Mm.
There are effective, evidence-based treatments, therapies like CBT, that teach you skills to manage the fear differently.
By facing it safely, changing those catastrophic thoughts.
Right. And medications that can help manage the underlying biology. It's not about magically erasing fear, but learning the mechanics and how to manage them.
It's clearly a massive challenge for people who experience this, but knowing what's happening, what the options are, and that professional help is available, that feels empowering.
It really is. Think back to Puss in Boots choosing vulnerability in that moment, facing a deep fear, especially an internal one like panic, and finding the courage to acknowledge it, maybe ask for help. That takes incredible strength.
Absolutely. So maybe the final thought to leave listeners with is something like this. If owning that vulnerability, like Puss did, was the first step to finding a new way forward, what could shift if we approached the scary mechanics of panic and avoidance, not just with dread, but with maybe curiosity and a willingness to understand and face them strategically?